STarT Back is a really fantastic tool for helping clinicians make the right choices for their patients.
It's probably the easiest business case to write.
I thought, this is brilliant. You know, this is a programme that does what it says.
Patients tell us that they're frustrated with the inefficiencies in the system that we have at the moment. It's even been referred to as being a bit chaotic care. There's just not a streamlined approach to how we get the early management right for patients.
We know from our research that some patients will have very minimal treatments, whilst other patients who do need more in the way of active treatment have real difficulty accessing treatment that can help them. So our team have wanted to develop a new system where early on in primary care, patients are more systematically identified who are not going to do well. And we want to use that information to better match them to the right treatments.
So the STarT Back tool is a simple screening tool that has 9 questions on it. Yes or no, nice and quick to complete, but it allocates people into 3 different subgroups: a low risk, a medium risk, and a high risk of having persistent back pain problems. And that enables us to then target treatments according to that risk profile.
Using the STarT Back tool, low-risk patients are matched to a targeted care package, which may include advice on self-managing back pain, reassurance and medication. Medium-risk patients can expect to receive good quality physiotherapy, and those who are considered high risk will receive an enhanced package of care using a biopsychosocial approach to assessment and treatment.
I see a lot of the patients in the community that do come through with back pain, so I would probably do maybe a couple of clinics a week where you would have 4 or 5 patients coming through. I like to use the STarT Back tool as a clinician working with my colleagues. So for patients it's really easy to use the tool. It gives you a measure to actually look at and support in your clinical decision making.
It's important, however, to recognise that it's not just about the tool. The treatment packages themselves are very effective, and I've confidence that they will help patients.
I've used it in my clinical practice. I work in a service that manages over 10,000 patients with musculoskeletal pain, and I found it really useful, and it helps me in making my clinical decision about what to do with a particular patient. It helps me decide whether those patients are at low risk or at medium risk or at high risk, and it ensures that I check my clinical decision making and the patient ends up getting the right treatment at the right time.
The financial benefits are significant. The STarT Back approach of matching patients to the right treatments reduces health services costs by more than £34 per patient. The burden to society generated through time off work due to back pain is cut by an average of £675 per patient.
It put me back in work, and I was able to carry on with my job. And I've said to people ever since, that's the best programme I've ever been on.
Within 12 months of the STarT Back trial being published, it's been adopted by 35 regions across the UK, from clinical commissioning groups to GPs and community physiotherapy services. There's also growing international interest.
Australia delighted us by taking it forward, and in America 2 of the big private healthcare companies have incorporated the tool into their electronic medical records and then integrated the matched treatments into their treatment packages. Nationally, private healthcare companies in the UK have also adopted it because STarT Back did show benefits for reduced private healthcare consultations. I think it is a win-win for everybody in that case. It's probably the easiest business case to write, to take forward into clinical practice.